Dr. Andrew Newberg with us here, who is a professor in our department and also in nuclear medicine. And he is the research director at the Marcus Institute of Integrative Health as part of the Department of Integrative Medicine and Nutritional Sciences, and a featured speaker at today's conference. So tell us a little bit about what you spoke about.
Well, I was mostly talking about the impact of nutrients on the brain. And I was reviewing information that we have gleaned from all of the research studies that are out there and a lot of research studies that we have done, trying to see how vitamins, minerals, antioxidants, and so forth can be beneficial for the brain, but also how best to use them. Because as with everything in integrative medicine, there's an important balance. Too much of something or too little of something can both be a problem. And so we have to find the right balance for these nutrients to keep us healthy and to help us to recover from different diseases.
What have you found in your own studies that were surprising, illuminating even?
Well, I think a couple of our big studies, which have been using a molecule called N-acetylcysteine, or NAC, have been very exciting. We have been looking at the effects of this molecule for a variety of different neurological conditions, including Parkinson's, multiple sclerosis, and concussion. And what we have found is that many of these diseases really stem from, at some point, oxidative stress. It means that there's actually too much oxygen in the brain, and it's the result of the injuries that are occurring as a result of these different neurological conditions. So if we can give people an antioxidant and help to remove some of that oxidative stress, remove some of that inflammation going on, perhaps we can see some benefits. And that's exactly what we've seen so far. When we did our first study in patients with Parkinson's disease, by getting a combination of oral as well as intravenous N-acetylcysteine, we showed that they had improvements of about 5 or 10% in both their clinical symptoms as well as in the dopamine functioning in the brain, which is the hallmark of Parkinson's disease. And this was really quite fascinating because Parkinson's is a progressive neurodegenerative disease, so it doesn't get better. And we were showing some evidence that it might.
So any improvement is a real finding.
Absolutely, absolutely. And similarly, when we looked at people with multiple sclerosis and we gave them N-acetylcysteine, their brain tissue turned on. When we were looking at the metabolic activity in the brain, we found that they had higher levels of metabolic activity in the brain after they had received the N-acetylcysteine. So it seems to be doing something to help the neurons in the brain function better, whether they may be dopamine neurons or other neurons, that could be very helpful for helping people with a lot of different neurological conditions. And we have another study that has looked at patients with post-concussive syndrome. So these are patients who have chronic symptoms from concussions that they got at least 3 months ago, many of them many years ago, who continued to have cognitive problems, memory issues, concentration issues, emotional issues. And when we gave them the N-acetylcysteine, we also found that they had pretty substantial improvements in these symptoms. They had reductions in their cognitive problems, improvements in their emotions, anxiety, stress, depression. So this is very exciting to be able to see this as a possible approach in the armamentarium of treating all of these different neurological conditions.
There's this tremendously promising research that you're doing with published clinical trials and the data that you just reviewed. Are there some of the patients who've gone through these studies that stand out to you?
Well, we certainly have had a range of responses. Some people don't respond as much, and some people respond a lot. And for the people who respond a lot...
Can you tell us about a couple of them?
Yeah, I remember a 43-year-old female who was in our concussion study who really was struggling and really felt that she was unable to think clearly. She was very depressed. And after she had taken the N-acetylcysteine, she felt like a light switch had been flipped. She felt that she was suddenly able to think more clearly. She was able to, her emotions sort of settled down, and she felt like she could go back to her work that she had to really cut back on and be able to function in life and function in her job in a much more effective way than she had ever done before since the injury.
Is there a Parkinson's one you remember?
There was a 65-year-old gentleman who was in our Parkinson's study. And when he received the N-acetylcysteine, he really felt that he was able to function more effectively. Obviously, Parkinson's primarily affects movement, and he felt that his balance was better. He felt that he didn't have as much problems with the tremor. And in fact, he actually wound up having to reduce the amount of the Parkinson's medications that he had been taking. They actually wound up being too strong for him because his symptoms had abated. So in that regard, it seems like it really was a wonderful addition to what he was treating, how he was treating his Parkinson's. And he was actually able to modify his medications by reducing them as part of as the result of taking the N-acetylcysteine, and he continued to take it to this day.